went to Tanzania
Mhm.
to volunteer as a nurse. I had been to Tanzania 10 years ago to also volunteer as a nurse, so I was familiar with the area. So I went with an organization, and basically I wanted to volunteer as a nurse, be able to give back, help people. I also knew that Tanzania did not have restrictions like we do here. So to me, that was also like a bit of freedom, not having to wear a mask, social distance. I just wanted to also go to live normally because this last year has been just crazy.
Yeah.
So, yeah, along with volunteering, we raised myself and other people came together to raise money to support a publicly funded hospital that served a poor community. And that's basically why I went down there. Go home, I was
And
getting so much anxiety because I'm like, oh my God, what's gonna happen? I've been living for 5 weeks completely normal, mask free. I don't think I'm gonna know how to go back to this chaos and have to wear a mask and people are temperature checking me and all these restrictions are in place. So a few people had sent me Chris Sky's video. I'm sure
mhm.
you guys have heard
Yep.
about, or everyone has seen that. And I was like, no way, like I didn't even know this was possible. So I started to look into, my Charter of Rights and what they actually say. As a Canadian, we should all know this, but it's been a while since I've looked at them. So I looked into it and I thought, well, this is completely valid. I shouldn't have to go to a hotel to quarantine when I have a perfectly good home. There was definitely like this whole energy of fear in the airport. I was nervous to do this because it's intimidating, there's police officers, there's public health nurses, there's all these people in position who have this power over you. So when I said, I'm not going to a hotel and these are my rights, I was quickly plopped out of the line as I was speaking loud because I wanted other Canadians to hear, like, hey, you don't have to go to a hotel either if you're a Canadian citizen. And then the officer just started yelling at me, shaming me, telling me to be quiet. And the more he kept forcing that on me, the more like anger I felt. And this guy's literally removing me so that other people can't hear their own rights. And I get it. He's just doing his job and he has someone to answer to. Public health nurses started shaming me because they were like, oh, you should know better. You're a nurse and you're going to get all these fines and blah, 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 blah. And the police officers were like, I hope you lose your job. And it was terrible. It was a terrible experience. Yeah, so a lot of people have sent me, I guess, photos of them filing complaints against me, which I think is absolutely ludicrous. Um, so yeah, there's been a bunch of complaints, I guess, related to this incident filed against me. I have never had any complaints filed against me as a working nurse for 10 years. I don't know anything as a nurse because I worked in plastic surgery, but that's not the case. Yes, I have worked in plastic surgery, but as soon as COVID hit, I was in long-term care homes. I was on COVID floors. I've worked in many other places than plastic surgery.
Mhm.
So that's why I thought, people are saying, you're a nurse, you should know better. And I'm saying, hey, yes, I do know better because I'm in the front line. And I'm working in these places and it's not adding up to me anymore. Has been doing and locking down and restricting us has not proven to prevent the spread of COVID. And COVID is 95% survival rate without treatment. So it's just all these measures that we're doing are harming more than COVID is, because what I have been seeing in the hospitals is increased suicide attempts, increased overdose, increased addiction, increased, heart attacks, increased delay of care. Like people are scared to come into the hospital because they think they're going to get COVID, and then it's too late. Like they're like ticking time bombs by the time they get into the hospitals. So I know there's a lot of other people who are speaking up against what's going on, and just the idea that our licenses are, at risk for having a difference of opinions other than the narrative that's happening. It's crazy. There's a lot of people who support me who are in the healthcare field who are just too scared to come out because it's directly going to affect their livelihoods. And I don't blame them, but eventually enough is enough. Sign the petition, because I do think it's an absolute infringement upon our right as a Canadian. And it's crazy that it's gotten to this. So it's sad to see that like there's this big cancel culture that's really dehumanizing now if you go against the mainstream narrative. And they've I guess reported my GoFundMe page, so that's stopped, or they're investigating donations, which literally directly affects the people that I'm helping, or the people that we're helping in Tanzania. So I just think it's absolutely ludicrous and disgusting. And I hope more people are willing to stand up for our rights, because as Canada, I think we've always just trusted our government, and it's almost like we're too polite to speak up, and we've abandoned our ability to push back against compliance. And I think these restrictions and lockdowns and all the measures are doing way more harm than COVID is doing.